So staying within the NHS was never really going to be financially viable. So it came down to have a practice or don't have a practice. And speaking with Ian Eslick was brilliant because he came in and did some pre-planning with me about our numbers that we had and what we would need to be targeted at. And it made it obvious that we were able to make the conversion quite straightforward with what we had. And the reasons for wanting to convert was really based on financials, was the main factor. Could see that my private income was really bolstering the NHS income, and it was just getting harder and harder to meet target. There was so much more paperwork, especially post-COVID, and the end straw for me was the lack of communication from the NHS when I needed help. So transition and the support that we got from Practice Plan was really down to training. We had a day's training with Ian, who came in with our reception team and all of our staff for those questions that patients were going to ask and queries, and how to combat any negativity and to get people across that line to sign up. Then there was the behind the scenes team, which I've never met, who were to deal with, we dealt with the letters, the marketing and the information that was needed to be sent out to patients. And then throughout the actual process, we had Ian gave us a list of questions that patients would have commonly asked in the past. And that was a real godsend because it just meant the team on the desk knew what was coming. So changes since making the move. Obviously, I've got an associate now who's full-time. I've employed, I've got two therapists who are part-time for the week, which has grown books. We have got as a staffing element and well-being, our staff are happier. There's not the footfall that you're having to deal with, 30 patients in a session. It's, maybe 10, 15, 20 patients a day, depending on what treatments you're doing. You've got more time with your patients clinically, as well as more time at the desk with patients. There's not this running through your day. Admin for me is a lot easier. There's no third party that has an invested interest that you're trying to answer to. Key points at which I thought this was working, because it was scary sending the letters and you think, well, I've done it now, was our target was reached within 6 weeks, and we had a window of 12 weeks. And I remember getting on to Ian and going, okay, we're getting near target. And he's like, no, hold. And then the deadline came and I was just like, what do we do? It was a weekend. Do we hold? We've gone over. I've got to feed the beast now. And he was like, hold for the weekend. And people signed up. We had another 100 on the Saturday sign up after the deadline closed, and another 100 on the Sunday. And Monday I was on to me and going, close it, because we've gone way beyond target, which was great. But at the same time, I'm starting to think of the logistics of actually servicing these people. So yeah, it was a very successful sign up very quickly. Contact Practice Plan, have a chat. That's all it is have a chat. Let them come in. If you depend on your area, obviously each area is going to have an Ian Eslick, but go have a chat. Let them have a little look at your books and your diaries and give you an honest opinion, because that's where we started.